Well, good afternoon or good morning. On behalf of the Columbus Board of Education, Dr. Jean Harris, Superintendent of Columbus City Schools, I would like to welcome you all to Devonshire today. We have community members, we have special guests, and most importantly, we have students at Devonshire Elementary School who are a part of a movement of being healthy, thinking healthy, and starting with wellness. And we talk about it. You know, Miss Scott, if she were here, she'd have your pedometers out and on you, wouldn't she? She would be having you work. Part of that also, preventative health, is vaccinations. Raise your hand, students in the audience right now. I don't want to take anybody's thunder, but who's gotten their flu vaccine? I've gotten mine. Excellent.
Who's getting it today? Yes.
Okay. Well, there's a whole line down in the library. Well, again, we want to welcome everybody. I'm Patricia Price, the principal of Devonshire Elementary. It is really my pleasure to introduce Dr. Teresa Long.
Again, thank you, and I'm so glad to be with you this morning. And indeed, thanks so much, Principal Price, for welcoming us. And good morning. And I'm going to have the chance to make an introduction in just a moment. But I also wanted to say hello to your school nurse who's here, Nurse Fire, Julie Fire. Is she not here? Oh, fine. So much for that. She's at the flu clinic. Well, actually, we're doing a flu clinic today right here, right? So, and that's where she is. And actually, we've got a whole team of people. I know my colleague Denise Abbott is here. Several of our nurses are here. Lauren Rose Cohen, James Diaz, and Vicki Craig. So a great team is here to try and protect you. But that's why we're here. So indeed, it's great to be here to talk about two of my favorite things, physical activity and, of course, flu prevention. And so if you're like me, and you probably are in some ways, that is, you like to stay healthy and safe, have a good time, and indeed for all of us, that does include eating healthy or healthier foods, maintaining a healthy weight, and, of course, being physically active and having an active life. What some of us don't think about all the time is that we actually have to add at least one more, maybe others, but at least one more to be optimally, to be as healthy as we can be. And that really is about getting vaccinated and protected against influenza every year. Every year. Frankly, I've already protected myself, and indeed I have a daughter and my husband. We have all gotten our flu vaccines because we traveled over Thanksgiving. So indeed, if you've had it already, and I saw some did, congratulations. That's what you can do. But also, if you haven't yet, please get it today if you can. Talk to your parents, talk to your families, your neighbors. Everyone needs flu protection, and it's really that way that we're going to have a safer and a healthier holiday season and obviously a beginning of 2013. Seasonal influenza, and if you don't know, it is a serious respiratory illness that can lead to hospitalization and even death. Anyone can get the flu, and that's why the Centers for Disease Control and we at Columbus Public Health recommend that everyone over 6 months of age, which would be everyone in this room, should get their flu vaccine. And getting vaccinated is really easy, and again, it's the best way that you can protect yourself, but also others in your family. And indeed, it's how we protect our entire community from getting the flu. And indeed, influenza is unpredictable, and actually one of the things that we're going to share with you this morning is that indeed this year, Central Ohio, right here in Columbus, we are having a lot more influenza earlier in our season than we have had in the last few years. So indeed, already here, our laboratories that are doing some checking, they are reporting to us a significantly higher number of influenza already here in Columbus and Franklin County. And indeed, our hospitals are already seeing more people and indeed have more people hospitalized. 4 times as many as the last 2 years this early in the season. So we know it's an early flu season, so again, now's the time, if you haven't gotten your flu vaccine, to get it. So we do, again, need to be prepared and to work together, and that's why we're here. It's actually why, and some people wonder, why do we care about kids and flu? Some people think it's about older adults or adults who have immune problems. It's actually about you, too. We love you. That's one reason. It's also that kids can get influenza, and you'll hear some more about that from our next speaker. But indeed, kids get it, and kids are also great at spreading it to all the rest of us. So you, indeed, are really important for us to protect. We want all of you to get your flu shots. So indeed, that's why my team and my colleagues are here joined with the Columbus City Schools, and we've worked with many other schools to try and see that we get as many school-age kids protected as we can. We also know firsthand, and again, that it's all about staying healthy. And I just saw someone have a sneeze. I hope you know how to cover that cough or sneeze. Okay, so the things that you need to remember, if you don't already know, is, yes, get a flu shot or flu vaccine, wash your hands, and indeed, when you have a cough or a sneeze, to cover it, and cover it not this way, but this way. Cover it either with a tissue or indeed into your shoulder. And of course, if you are sick or if someone in your family is sick, they need to stay home or you need to stay home. Again, that's how we protect people. So I'm going to stop talking and say I'm so excited you're here. I'm glad to see as many of you have had already your flu vaccine. The rest of you, I hope you can get it today or work with your moms, dads, your caregivers, your grandparents, and neighbors to be sure that they get theirs and you get yours. But I want to introduce to you someone who's been a great partner of ours here in Columbus. He is a leading infectious disease physician here in Columbus. He also is the chairperson of the director of epidemiology, which means looking at infections in the hospital at Nationwide Children's Hospital, and he's the chair of our state's health immunization advisory committee. So he's a big expert and a very important colleague who cares lots about kids. Coming to you from Nationwide Children's Hospital, our very own Dr. Dennis Cunningham. Dennis? I mean it all.
Well, I thank you. Hey, everyone. How are you doing today? This is pretty exciting, seeing all these people visiting, plus you get out of class for a little bit, so that sounds kind of cool. So who can tell me what the flu causes? What kind of things does the flu do to your body? Go ahead.
Make you sick and very ill, and sometimes it can make you delirious.
It can make you sick and can make you ill. The things that flu does in the most of the time, oh, I see a hand up there. Go ahead. Yeah, high temperatures, fevers. They kind of make you feel really yucky, don't they? The other things flu does besides these fevers, you're usually sick for about a week, high fevers, and you really just want to lay on the couch or stay in bed. You feel awful. You're kind of achy all over. It hurts when you move. So that sounds like a real bummer to me, so I don't want to get that. Does anyone here want to get the flu? I think you're better off getting the vaccine because then the flu stays away. And just like Dr. Long mentioned, her family's gotten vaccinated. I have a daughter who's 8 years old. My little boy is 5 years old. And both of them got their flu shot, as did Mom, and I got it at work as well. And at Children's Hospital, we actually are working really hard to offer flu vaccine to any patient walking through our doors during this season. So you can ask your moms and dads about getting the flu vaccine if you haven't already. So why do we want to vaccinate kids? Well, it turns out you guys have a really important job. If you're vaccinated, you're going to prevent the flu from coming home to your mom, to your dad, to grandparents, aunts, uncles, all of that. And in a couple different times in Japan, they had a program in the 1980s where they vaccinated everyone who went to the schools in Japan against flu. And it turns out they were able to get more than 80%, or 8 out of every 10 kids vaccinated. And guess what? The flu almost disappeared in Japan. The number of hospitalizations went way down, not just in the kids, but grandparents and parents as well. And that was a really big study. There's also another study just like that in Michigan, up a little north to us in Tecumseh in the 1970s. They did the same thing. They took 2 towns. One town they vaccinated the school children, the other they didn't vaccinate. And guess what? There was a 75% reduction in the flu cases in the town where the kids got the flu vaccine. So this is a really important job that you can do to help prevent it and keep your family safe and yourself safe. Because I'd much rather see you here at the school and give you a vaccine and we're going to protect you rather than you have to come into the hospital and be sick. I mean, we take care of anyone who needs it, but would you rather be home feeling good coming to school? I would. So there's 2 things that I want you to remember today. Most important thing to keep yourself healthy from all different colds and viruses and things that make you have diarrhea and vomiting is washing your hands well. How many people always wash their hands after they use the bathroom? That's awesome. It's really important to do that. That is probably the most important thing in the world to keep us safe. The second most important thing is you want to ask your parents if you hadn't had a flu vaccine about getting it. And they can talk to their doctor or whoever your primary care doctor is, and they'll share that about what the benefits are and help to keep you healthy. So thank you so much for all your time, and I hope you have a great day, and I bet you're excited for the soccer coming up. I know I am. Have a great day, everyone.
The next person I'm going to introduce is important because, not what some of you might think, but because if I said, I'm going to talk, Ms. Price, the principal of Devonshire, is going to talk about vaccinations and flu clinics, and would you all come? As special as I am, I don't think people would really listen, and same with Dr. Long. So this is very important. We have with us a champion for kids and their health. This person is known for lots of things. Probably most importantly now, she's a mother. She's a sportscaster. And what she has been and continues to champion for is soccer. She's known for winning not 2, but 3 medals, Olympic medals, 1 silver, 2 gold. Ooh, very cool. And 2 World Cups, and won the winning kick against China that I don't think anybody will ever forget. So it took somebody with those skills and that persona and that passion to talk about children's health and immunizations, and that is Brandi Chastain. Can we welcome her, please?
Good morning, cheetahs. Good morning. You know, I have a 6-year-old son, and he's in 1st grade, and I can't tell you how excited he would be to know that I got to be here with the cheetahs, because the cheetah happens to be his favorite animal. Do you know that what a cheetah uses its tail for? In the back, orange jacket. Balance and steering, that's right, because they're going, how fast do cheetahs go?
85 miles.
85 miles an hour they can run. Not very long, but they can go over a very short distance very, very fast. So he would be very excited that I'm actually in the room with a cheetah like this. So this is very cool for me. I get to share that with him. And I get to also share with him how important it is that we remind one another. You guys friends? You have friends that are sitting here? So I get to remind my son, and then he can also remind his friends that we're responsible for one another. As friends, as a community here at your school, that we have to take care of one another. And so to take care of one another means that we have to be healthy. You've heard all the adults say, I'm just a big kid, really. You've heard all the adults say all the stuff that's really important for us to do to make sure that we stay in school. But for me, as an athlete, it was really important that I stay on the field, to be in the Olympics, to go to the World Cup, to make that winning penalty kick shot. I needed to be healthy. And to do that, I had to do all the right things, which was eat well, get a lot of sleep, hydrate myself with water, practice. I had to also be vaccinated. Now, we've heard from the doctor that the flu comes around every year. Does anybody here play on any kind of sports teams? Any. Doesn't matter if it's soccer. Awesome. So, put your hand down. Who goes to school? Ah, there we go, everybody. So school, every year is different, right? This year you might be in what grade? 1st grade. This year you're in 5th grade. So it changes every year, just like the flu. So you have to be prepared every year for the next thing that's coming. And that's why getting vaccinated is so important, because you want to be on the field. Wait. I ask my son all the time, when you come home and your parents say, how was your day? And you say, good. And then I say, what was the best part to my son? What would you say if someone said, what's the best part of going to school? Recess. That's what he says every time. But if you're not feeling good, you can't have recess. Who wants to miss that? Not me, for sure. I loved going to recess. So please remember, washing your hands every day here at school, before lunch. Can you make me a promise that you're going to go and wash your hands with soap? Yeah? That's the important part. Use that soap. Wash really good. Sing a song if you want to. Stay there for just a little while longer. Wash those hands. so that you can go to recess, so that you will be healthy, that you'll come back every year feeling good and being your best. Now, why it's important for us to come to elementary schools, they've already said. This is a community of a lot of people, and kids put their hands on things, and that's awesome. We explore, we try things, and that's good. But when we do that, we also possibly could be sharing things as well. So if you guys are taking care of yourself, you're going to take care of your community, and you're going to do that at home as well. And what I love to tell my son is that I want you to be a leader. Who wants to be a leader? On the soccer field, I had to be a leader sometimes. Sometimes I had the ball, and so then I was in charge. I passed the ball, and the next person was in charge. So we all have the responsibility to be leaders. And I want to see good, strong, healthy leaders like here. I want you to be the example to all the other kids in Columbus, if not all the other kids across this country, that taking care of ourselves is valuable and is very important. Does anybody have any extended family living with them? I have my mother-in-law, so my son has his grandma living in my house. Anybody have grandparents or cousins or aunts? No? Yeah. See, now you can go home and be leaders for them too. Because you know what? Kids are smart. You got a lot of brains up there, I know. My son has a big brain, that's what I call it. So you can go home and say, if you have not been vaccinated, Mom and Dad, aunts and uncles, grandmas and grandpas, let's go get vaccinated so we can all be healthy, and you can come and maybe see me on the soccer field or on the baseball field or on the football field, on the basketball court, track and field, whatever it is that you like. Or maybe they can come watch you here at recess. You want to be fast like cheetahs and strong like cheetahs, right? You want to be strong like cheetahs? Yeah. I don't think I heard you. You want to be strong and fast like cheetahs? Yeah! So if you're going to be fast and strong, I need all that when we start to play soccer. Who's going to participate in soccer? Yeah, the principal? Did you know what she told me? Listen to this. In 1999, I played in a really important Women's World Cup soccer game, and I got to take the last kick. She was backpacking in Alaska and hiking. After she was done, she went to the next day and watched the soccer game. So I'm going to ask her if she'd participate in soccer with me right now. Would you like to see that? Yeah. All right, here we go. Principal, stand on up.
Oh, thank you.
Okay. So soccer is about teamwork. And that's why I think it's really important that and for me, why I said yes to working with kids with flu mist about keeping healthy. Because if I don't work with my teammates well on the soccer field, we won't be successful. And just like your school, if you all don't be the leaders that you can be and work together on staying healthy, your school is not going to be healthy. So come on over here. Okay, so we're going to do a little heading drill. It's going to be really easy. Okay? Most important thing is you keep your eye on the ball. Don't take your eye off it. Don't be stiff. In soccer, you kind of have to be loose. You have to be on the balls of your feet, right? Because the ball could go over there, could go over there, could go here. So, also the most important thing, one of the most important things about soccer is that you have a little bit of bend in your knees, right? You can't play with your legs straight. So, heading the ball is about, I call it a dance. Does anybody like really fast, cool cars? Me too. Me too. Right. So, your principal's like a really cool car with some good shocks this morning. Okay? All right. Okay, good. Already, so that's pretty good. So all I'm going to do is I'm going to ask her to bend her knees. When the ball's coming, she's going to just push up with your knees, not neck, no funky anything like this. Just with your knees. But first I'm just going to give you an example. You're going to throw it to me. Just throw it up here. I got you off the hook for a second. Nice and easy, right? You can do that? All right. Ready? Yeah! start somewhere. Okay, listen. You're going to toss it to me. I'm going to head it to you, and you're going to head it back to me. Excellent, excellent.
Harold, I'm going to call a friend.
Harold, will you come on, Harold? Harold, you look like a soccer player. You take that one. I'll take this one. All right, you ready to do that? Ready to do what we just did? Come away from the podium. Okay, what's important? Gotta bend your knees. Yes! All right. This is exciting, isn't it? You know what's really exciting? The fact that we can be up here because we're healthy and we're strong, and we do that by taking care of ourselves. Okay, there we go. We'll get some room. Okay, remember I talked about bending our knees, Harold? It's starting to get hot. So now we're going to just do this, Harold. We're going to take the ball, we're going to toss it up just above our head, we're going to head it once, and we're going to catch it. Catch. Okay, you ready? Very nice. Now we're going to do two. Catch. Yeah? All right. It's all right. Now, here's what I would say. Get your feet a little bit more square. There you go. Nice and simple. You're going to bounce once, twice. Watch this ball. It's just going to go straight up. And I'm just moving my knees just a little bit. It's okay. Come on. Yes! Now remember, when it comes down, you have to stand up a little bit, right? Just pop it right up. Keep those eyes on. I'll do three first, okay? Okay. Yeah? All right, all right. You know what? I have to say, Harold, and to the principal, thank you for asking Harold to come up, and thank you, Harold, for having the courage to stand up in front of your whole class here, because that could be a little bit scary, and your tummy could start getting butterflies. Kind of like what could happen if you're getting your vaccine for the first time. Maybe you're a little nervous. You know, everybody asked me when I went up to take the penalty kick, what was I thinking and how was I feeling? Everyone was like, were you nervous? And I said, I was excited. Maybe a little bit nervous, but I was nervous because I was excited about what would happen once I took the kick, or how I would feel once I got my vaccine. I was kind of nervous, a little butterflies, but then afterwards I felt great, right? So that's what you have to remember. When you have a challenge in front of you, who likes tests? Awesome! Awesome! For those of you who are a little nervous about tests, think about this. When you play sports, like me, I go to practice. Every day I go to practice, I'm trying a new skill, whether it's juggling with my feet, or juggling with my thighs, or with my head. Whatever it is, I'm practicing, right? So every time I go to practice, I'm working on getting better. Every time I go to the classroom, I'm practicing. And I think that the game and the test are the same. When you go to the game, you're nervous and you're excited, but you've practiced all week, so you should feel good and confident about what you're about to do. So if you want to think about tests like that, that's the way it makes me feel better. So right now, I want you to do me a favor and see how good you guys are at math. I want this to come from the first graders. First graders, raise your hand. Okay. Can you count? Okay. Now, do me a favor. Do me a favor. Don't get ahead of me. because that's going to be the tendency. You're going to want to get ahead of me. But only count every time the ball hits my head. Think you can do that? With your best counting. Where's first grade teacher? All right, let's see. Ready? Make your teacher proud. Ready?
1, 2, 3, 4, 5.
Oh! Okay, good counting. Sorry, that's bad. I hope that it's going to be a little bit higher than that this time. Okay, ready?
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31, 32, 33, 34, 35, 36, 37, 38, 39, 40. Nice count. All right, so I know we're going to do a little bit of soccer with everyone. We're going to do some soccer with everyone. But I want you to do me a favor. I want you to do me a favor right now. And let's review what we've talked about this morning because it's really, really important. Who wants to be out on the playground at recess? Awesome. What's one way we can make that happen? Raise your hand. Yes, sir. Staying out of trouble?
Very nice. I like that. Staying out of trouble.
Not being sick.
Not being sick.
Getting plenty of exercise and keeping yourself healthy.
Good. Exercising regularly to be healthy.
Being safe.
Being safe. Excellent. Get a vaccine. That's right. Yes. Stay hydrated. You guys are good listeners. Yes. Yes, sir. Doing your homework. Outstanding. Yes. That's right. Getting your flu vaccine. Very good. Washing your hands. Yes, sir.
Having self-hygiene. Self-hygiene.
Hygiene. Yes, that's right. Having good hygiene. That's very good.
Listening to your teacher.
Listening to your teacher. Yes.
Being careful.
That's right. Be careful. Taking care. Yes.
Eat healthy.
And eating healthy. These are all. You have one?
Doing all of your work.
Doing all of your work. And last one? That's right. Being alert and being aware to what could possibly be danger. Okay.
And staying healthy by eating vegetables.
That's right. Eating vegetables will help you stay healthy, and fruit. That's absolutely right. That's cool. So you guys all know this information. Now, listen. I coach soccer. Okay? So I played soccer my whole life. You know how long I've been playing soccer? You're not going to believe this.
20 years.
You know how long I just headed the ball? For that long. 39 years I've been playing soccer. I know it's hard to believe. I only look like I'm 20. All the adults know that joke. But now what I do is I love to share soccer with players. So I want to tell you that when I go to the field to give a player some information, just like your teachers, good job on coughing like that, very nice. Just like your teachers give information to you, the information is yours to do whatever you want with it. So I hope that when you go home today that the information just hasn't gone away. That you actually put it into practice and you think every day, like, what can I do to be better tomorrow? Because today I was pretty good. And right now, if I had to give you guys a grade, I'd give you guys awesome. You were smart, you were engaged, you answered the questions very well. We had a great representative come up here, so I think you're awesome. Just think how much more awesome you can be tomorrow. Should we play some soccer? Yeah! Should we keep going? Yeah.